most of the patients that I work with have seen another clinician before. Often they've seen multiple clinicians for the problem that we are trying to address. And I will ask if there's been anything that's been particularly fruitful or helpful to help me, again, kind of via the verbal history, whittle down possible diagnoses. And a lot of patients have seen chiropractors before. And so when that comes up, I typically am asking, were you manipulated? And if so, what was the result? And the reason that I ask that specifically is because manipulation or adjustment, cracking, is a high velocity thrust through a joint. And if that was fruitful, if that symptomatic effect or even effect in terms of positive changes with range of motion or strength, if that effect lasted several days, then that increases the likelihood in my mind that the joint is actually the problem. And if you move it a certain way, it does have positive effects. Now, if the effect only holds for a few hours or a day, that's not quite as credible to me as the effect lasting several days or more. Manipulation, like I said, is a high velocity thrust through a joint. I don't regularly manipulate patients. I feel like there's not a need for it. And best case scenario, we can teach patients how to move their own joints. I think of 5 levels of force, and then the 5th level of force is a manipulation, and I don't find the need to get there often. If I do get to that highest level of force, it's because we've moved progressively through the stages of force to a joint to the point where we're plateauing with mobilization, we're plateauing with lots of repetition, and it's proven that it's suggesting that we need more velocity, more force through that joint. But again, the verbal history, part 1 of my evaluation, is really trying to, just like the physical exam, gather data that helps me think about what this problem is diagnostically. And so if someone says manipulation has no effect, well then maybe it's not a mechanical problem, but maybe it is and the joint is being moved in the wrong direction, or it's too much force too fast, or any number of things. But if someone is really saying, I get manipulated and I feel so great, I will also usually ask a follow-up question to that, which is, do you know what position you're in when you get that joint manipulated? And sometimes they do. It's not very common that they do. And many patients will report that they get manipulated in lots of different positions. So that's not that helpful. Now, we know that kind of any manual therapy most times will present or create a positive effect. It's just somewhat placebo, somewhat the effects of touch. But if we can be precise and say, I get manipulated on my stomach when my mid-back is forced into extension, that again is more specific, more credible, that there is a higher likelihood that this joint needs extension. So if patients can remember the specifics, that's really helpful. But using this information from prior chiropractic care, if PRP was helpful, if hip strengthening was helpful, if foam rolling feels good, all those things, time considered, meaning I don't have 2 hours to do a verbal history, but in that time that I do have, I'm trying to gather the most salient points to really help me think about, okay, for part 2 of my evaluation in the physical exam and part 3 later on, what do I need to gather in terms of physical baselines? What range of motion do I need to test? What strength would be important to test? What nerve tension, etc. And that combined with the verbal history in part 1 gets me to the part 3 where I have to decide what clinical tests are important. Is this person a candidate for repeated movement testing? If so, which joint, which direction, which load? Is this person a candidate for an image? Is this person a candidate for some orthopedic special test for ligament stability, for example? There's a process to an evaluation, but gathering information about prior care, and especially if a manipulation was helpful, whether it was performed by a chiropractor or another type of clinician, that is just one data point, but sometimes it's quite helpful.